Hello. So our listener submitted a question. I'm going to paraphrase it a little bit. Kind of the highlight version of it was, hey, does cold weather cause limping more, and when should we worry about limping being a problem? So good question. We'll go through a little bit. Some of that's a little easy to answer. Some of that varies depending on the owner, and there's not always a right answer depending on every case. So here we go. So yes, in my opinion, I do think colder weather does exacerbate underlying arthritis for the most part, or underlying aches and pains, things like that. So is that something that I typically see in my younger or middle-aged patients? No. Do I see those have arthritis sometimes? Yes. I have found arthritis on x-rays in 1-year-old patients a handful of times. So like I said, a little bit of variables depending on what's actually going on in that specific case. But for all intents and purposes, younger patients, most middle-aged patients, really just because it's cold weather shouldn't be limping and gimping. Do we see it a lot more in our geriatrics and older patients? Yes. Here we typically consider them crossing over into the geriatric realm once they get past 7 or 8 years of age, both on the feline and canine side. There's actually lots of arthritis in cats. Just it's way harder for owners to pick it up in cats because they're rarely playing fetch with them, walking them, and they're just a little more solitary and a little more lazy. It's just a little harder for owners to pick up on that. Biggest, easiest way to do that in cats is pay attention to litter box issues. And one South Carolina study actually said arthritic cats get more active at night than during the daytime. I don't quite understand that because I feel like they're predators. They're really good predators, and they tend to hunt more at night anyway. So I don't really understand that one, but that's what the research said from a couple of years ago. So FYI, for you feline owners worried about arthritis. Side note, there is an injection called Solensia that has worked very, very well for a lot of feline arthritis patients. It's about a once-a-month shot, so very convenient for you feline owners. It's been great. So back to the question. Yeah, so the geriatrics, yes, we do see it a lot more in them. Just like people, they get a little more achy. Depending on your age, you can extrapolate from personal experience or parents or grandparents or something like that and kind of ask if they live in the area. So the second part of the question was, okay, my dog's limping. This also can apply to cats for the most part. When is it a problem? When is it not? So that one's a loaded question, and it just varies dramatically. Some patients, there's blunt, obvious trauma. They have a dangling leg. Yes, you should bring them in. There's other things that can kind of progress where they're neurologic, like IVDD/back disease. Those can be gradual. They can be sudden. So there's just a lot of variables there for what the right answer is for that question. So most of these are going to be, hey, I came home, my dog is limping, favoring the leg. Is it a problem? How much time should I give it? What do we do? So excluding the extremes, that's what we're going to mainly focus on. So there's different answers, like I said. Sometimes owners are present. If you heard a loud pop or a sudden yell and they're running in the backyard and all of a sudden now they're not, you should probably get seen sooner than later because we find lots of knee issues. Smaller dogs get lots of luxating patella issues, and those tend to come and go. Probably just have your vet look at that and kind of give you an update there if you got it or not. So limping, for most patients, I'll tell clients, you can give them 24 or 48 hours, kind of see what they're doing. Typically, if they're still favoring it after that, yeah, you should probably bring them in. There's princess mode dogs. So some that are just like, oh, my nail's torn. I'm done. I can't do anything. A lot of dogs actually do hurt their nails and need just a little encouragement, and then they're good there. But I'm talking about the drama queens here in El Paso. A lot of clients say chicle. So those patients, if you have one of those, you probably already know, sometimes they're just a little touchy. And we'll have a lot of clients be like, hey, we've been favoring the leg, holding it for the last 2-3 days. And then they get here, get in the parking lot with the smells, the noise, the excitement. And now they're walking on 4 legs like they got no problem. And I just call those fakers. And problem is a lot of clients can't tell till they get here. The vast majority of those tend to be strains and sprains versus actual broken ligaments, bones, neurologic, more serious things. But some do need some intervention. They're just really sore, hurts, and need a little encouragement to get over the hump, and then they're good. So some little bit of common sense with it, but it can be challenging. A lot of dogs will get little stickers in their paw. Depending on your yard, if you have a lot of stickers, look for stickers. Fuzzy breeds attract more stickers, more dirt, more everything. They're a little more predisposed than our shorter coated breeds. They can still step on stickers, but they don't tend to just attract all the stickers. So watch for those things. Look at the nails. If they look excessively long, sometimes that can be a contributing factor. It can be little simple things. But kind of watch, touch, probe. You can flex things. If things hurt, probably need to just get seen. If not, rest them, running, jumping, playing for 5 to 7 days. And then they're still favoring it after about 48 hours. Yeah, you should probably just get it looked at. It's better safe than sorry, and kind of go from there. And nobody wants to be painful. And the whole reason people bring their pets to the vet is because they care. If you didn't care, you wouldn't be here. Every now and then somebody just feels really guilty. That's a small percentage. Most clients come because they care. If they didn't care, they wouldn't be here. So hopefully that helps a little bit, guys. And thanks for taking care of your fur babies, and let us know how we can help. Bye.